Hi, as you listen to my talk, I will share with you the barriers to access mental health care. I live in Malaysia, a multiracial Asian country. My name is Z, and as you follow my narrative, many of you will realize the nuances between the Western world and Asia. And feel free to comment below if events I describe are also happening in your country. I am a medical doctor, but today I will be speaking to you just as a concerned citizen. In the year 2015, it was estimated that 1 in 4 Malaysians suffer from hypertension and 1 in 5 suffers from diabetes. I'm sure all of you here knows of at least one person who suffers from hypertension or diabetes. Well, I do. In the same year, it was also estimated that 1 in every 4 Malaysians suffer from a mental health disorder. But do you know of anyone who suffers from this? We must ask ourselves, why is this happening? Well, basically, of those estimated to be ill with mental disorders, 30% or 1 in 3 do not seek medical treatment. Here in Malaysia, we do not seek medical treatment because of the baggage of stigma that it comes along with. And if left untreated, mental illnesses can progress, causing suicides and increase the risk of getting ill from cardiovascular diseases, diabetes, and others. Typically, in Malaysia, when seeking for help from friends will normally brush it off and say, "Don't be so weak. You are not even trying. Well, get a hold of yourselves." Adding salt to wound, these are the very same friends that may turn around and joke about it with others. And if you seek help from family, they may say, "You are not resilient enough. Don't be an embarrassment to us." Does this happen to you? The condition of mental health illness is as real as a heart attack or stroke. But no one tells a person having a heart attack, "Hey, get a hold of yourself," or "Hey, stop being so weak." So why are we shaming those who are mentally ill? This is stigma, one of the greatest barriers for anyone seeking appropriate mental health care. This stigma has become such a taboo that 20% will lie to family and friends about the diagnosis of mental illness. And just as a reminder, before today, society has warned against stigmas, like the stigma warned against women's suffrage and women's driving. So, let us put a stop to this. Here, I ask for empathy, to treat those who are mentally ill as you would with those with diabetes and hypertension. By doing so, we can inspire others to follow, allowing everyone to talk about mental illnesses freely, removing the stigma of mental illness from our culture. If you see someone who is excessively worried, have sleep problems, have irrational fears or emotions, are overtly self-conscious, or panics easily, reach out to them. Ask if they need help. Talk to them. You may save a life. As for those who are suffering, it is okay to seek for help. Below, I have linked website and a hotline for you to reach out to. As for me, I feel that a world without stigma of mental illness is a pretty good idea. Can you imagine walking into a clinic and being able to speak to the doctor about the stresses and anxiety that you face at work? So, let us do this together. Fight this stigma and remove this barrier towards seeking mental health care. Thank you very much.